Hello, everyone. My name is Emma. I am a health visitor by profession, and I am also the CEO for CareLink Academy. Welcome. So this is a follow-up video. As done, I did a video on level 3 diploma, and this is just a follow-up to highlight some of the tips and help you to support those that are already doing the course or thinking about doing the course. And the reason for this is that many of the carers that I've spoken to always complain about the fact that those that are already doing the qualification anyway, they talk about their work being returned, their work being referred. So I just thought I should put this together for you to know what to avoid to help you to get on and answer the question as expected to meet the requirements and the learning outcomes of the units. So if you're already working in the care sector as a care assistant, this qualification is for you. As I already said, it's a level 3 qualification in adult care. It's a well-recognized nationally qualification. So you gain, once you qualify successfully, you have, you know, opportunities. You can become a team leader, you can take on more responsibilities, and most importantly, you can also earn better. So the purpose for this video is just to guide those that are already doing the course and to encourage those that want to do it, that you can pass it first time. Yes. So you can't pass it first time because we know that if you're combining your care work and earning the your qualification, it can feel overwhelming. It can really feel overwhelming. So the key here is for me to try to ensure that I've given you these basically 5 tips to avoid the mistakes that will help you to answer the question as expected and hopefully pass it first time. So, for those that are already doing the course, what do you think is the first mistake that should come to mind? The first mistake that should come to mind is that if you ignore the command verbs, if the unit's learning outcome is expecting describe or explain, and you just go ahead and list them, it's unacceptable. You have to decode what describe means and explain, you know, what the task is requesting. So the second mistake that is very obvious is when you're not linking your answers to the legislations, the laws, even the policies at work, and your standards. You have to link your answers to that because you're not working at random. You're following procedures, you're following the laws, you're following the standards. So we need to see it in your coursework. And the third mistake that is commonly noticeable again is that lack of real examples from work. Use your work, keep a note for yourself where you can use it as a reflective journal so that something happens, you know that you got that fresh when you want to answer your question. Even if you don't use it for the unit that you're working on, there will be time where you can go back, reflect on it, and then you can use that. So you cannot just use vague statements with no proof. No, that is totally unacceptable again, because what will happen there is that you are looking after real patients. So you cannot give us any vague statements with no proof. So the final mistake that I know that always come through for mistakes that we observe is you don't have a structure. You don't have a structure. So if you don't have a structure for your work, it doesn't flow. So if you write it there, write it there, write it here, we cannot just, because that is what you're telling us to do with the patient, though, isn't it? You're doing that with the patient. The patient is all over the place. No, we cannot accept that. So encouragement I would say is that this is very normal. That is why I've also put in a success bundle for to give you the exact structure on what to use and how to use it. So if you want to enroll with CareLink Academy, you will not just get the course. You know, as you know, CareLink Academy is fully accredited by Highfield, and your learning is flexible, 100% online. You can walk around, work, and life. So we are there to support you. You have the tutor support. You can ask questions if you're not sure of the answers or what expectation is required from the for the unit outcome. You have to write, and you have to let us know. If you let us know, then we will follow you through. So we are here to help you through the assignment and portfolio. So don't sit down and guess it on your own. Reach out. We give you clear, honest guidance. For me, because I'm in the system, I know the sector, it will come easier for me to tell you exactly what is expected and honest about it. So clearly, what I'm encouraging you to do is that subscribe for more guidance, ask your questions. So if you subscribe for more guidance, this is your career and you deserve all the support every step of the way. So I'll see you in the next video. Take care.